Thank you for joining us for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. And we're hosting a press briefing today to discuss the state of COVID in the Itasca area. We have panelists joining us today discussing how our schools, our childcare, and our healthcare are doing, sharing challenges and successes with what we have learned during this pandemic. And I will begin first with our Itasca County situational update. We have had a really rough fall and winter. We've had two variants of the coronavirus, Delta and Omicron, affecting not only our infection rates, but also our number of hospitalizations, ICU stays, and sadly, also our death numbers. We topped out our number of cases in December and again in January. 171.8 was our all-time high of a 14-day case rate, and that well topped out our high of 129, which we reached in late 2020. Positively, we have the availability of at-home rapid antigen tests. However, we want to be forthright with the fact that these are not counted in our county numbers. So we've really had a much higher COVID rate than we can show with the data that we have. But we are so happy to have these testing options, which allows our residents to make safe decisions on their activities without infecting others, and especially our most vulnerable. We can access these rapid tests by ordering online, by visiting our area pharmacies, and our PCR tests are coming back in just over a day. And those are the tests that you receive either at a pharmacy or at our clinics and hospitals. And for anyone who is not desiring the nasal swab option, saliva tests can be ordered via mail at no cost to our Minnesota residents if they're ordered from the Minnesota Department of Health website. This past year, we have strived to find a balance all over the county, and we're balancing the safety from this very serious virus while continuing our activities and promoting our connections to others. And this is so important for our mental, our physical, educational, and economic well-being. I'll shift now to some numbers, and I'm going to start with our vaccination rates. Over half of our Itasca residents have started their series. That's 25,264 of our residents, and that's 58.8%. For our 5 and older who are eligible for the vaccines, 62.1% have begun their series. Our case rate right now, our 14-day case rate is 108. And again, that's down from the high 170s, which we saw at the end of January. We've had 133 deaths from COVID throughout this entire pandemic, and just under half of those actually occurred in the last 5 months. We went into September of 2021 with 71 deaths, and we've had 62 more since September alone. As we move into the introduction of our panelists, I do want to express my gratitude to our community partners, our residents who have worked tirelessly for almost 2 years to keep our community safe. And truly, from the bottom of my heart and our public health team, we are so happy to see the collaboration and caring from those who have worked together. And we're so appreciative of you all. I will now move into our panelists. We will first hear from Pat Reindel. He's Superintendent of Hill City and Northland Schools, and he's Chair of the Itasca Area Schools Collaborative.
Good morning. The Itasca Area Schools Collaborative is made up of Nashua, Keewatin, Greenway, Grand Rapids, Deer River, and then the two schools that I'm the superintendent of, which are Hill City and Northland, and then it includes ICC, our community college. I think that I'm not exactly sure what I was supposed to report on. I guess I'm going to give just a real quick overall view on. I'll try to speak as a member of the collaborative, but I think at this time I also have a hat of two of my schools. I'm going to break it into 3 real quick things. What was it like before? What have we learned? And what's it like now? As we know, before, the state took charge and they told us the criteria, and there was a lot of people on the same page. And in the end, in the criteria, everybody sort of took a different piece of that criteria of what they were kind of following and their matrices and so on. Some schools started right away with the numbers. Some schools looked at how it impacted their own community, but back a year ago, I'm not going to say it was easier because we all kind of were speaking the same language, so to speak. But one of the things that everyone cried for was we wanted more local control. And I remember my colleague, Dave Pace from Greenway said, be careful for what you ask for, because that's what we got. So now we're in local control, and there isn't anyone that wouldn't say that's more complicated. We got what we wanted in local control, but then it became more complicated. And so in general, speaking as somebody that's just speaking for the collaboration, what we've learned is that the decisions are a lot more difficult. And in the sense that now our boards, we have to listen to the board, we have to listen to what our communities are telling us. The superintendents, of course, guide those decisions. And in the end, we're trying to do what's best for kids. So the journey for Grand Rapids is a lot different than the journey for Hill City and Northland. And I forgot to mention Floodwood's part of this too. The district schools like Grand Rapids have a different journey than Pat Reindel has in my two smaller schools in my communities. The good news is that we get a lot of help from Kelly. So every week, all of us are listening to Kelly. Just now, I got off of a Google Meet with all the range schools and all those counties. In my world, I listen to Cass County in my Northland school. I also have a bi-monthly meeting with Aiken County now. And so we get a ton of input. We hear a ton of stories. We hear a lot of what's going on in all the communities, not just our little world. And it really helps me drive the decision-making and guidance in my two smaller communities. I would say the other thing we've learned, at least I feel like we've learned, is that though it's more complicated, I think kids are back at the center of this. And we talk about this all the time, about the goal being the overall health of a student versus is it just the virus. And some schools have shifted to a philosophy of it's trying to do what's best for the kids, which means we need to keep our kids in school. Everybody's done that. That's our primary focus because we know it's the best place for them. And that's been our primary goal. We get there in a little different way. Each of our schools gets there in a little different way, but ultimately we're trying to keep our kids in school and not give them reasons not to go to school. I mentioned about just the relationship piece. Never before have I ever had so many great relationships with so many of my colleagues and sat in and got to know these people so well. I just said to Kelly a second ago, I think we've known each other now for 2 years. I don't think I've ever met her in person, but I feel like I know her because she meets with us, talking specifically about IAS. She meets with us every Wednesday and she updates us, tells us what we got going on, gives us guidance. And I know she has a very difficult role because she wears not only the hat that she has working for county health, but she also is a parent and she's educated and she has so many other hats she has to wear. So absolutely appreciate the relationship we have with her. And the last thing I'll say now is I think the phrase we used yesterday was talking about response versus recovery. And this transitionary period we may or may not be in right now. We get excited thinking today, I think we heard as a general rule, so these numbers are starting to come down. We've reached our peak. Everybody's getting excited. And so we're starting to have that conversation. So I'm using that. I've been using that term quite a bit since I learned it yesterday, Kelly. So that being said, I guess that would be my update in my chair, speaking for my colleagues and IAS.
Thanks, Pat. And just know we learn as much from you as you say you learn from us. So thank you so much. And we'll now hear from Jan Reindel, Executive Director, Invest Early.
Hi, good morning. Thank you for the opportunity to talk about Invest Early. We serve children in each of the 4 Itasca County school districts. 6 weeks through kindergarten entrance are the ages of our children. I'm going to talk about the challenges we've had in some of our celebrations. So our first challenge is meeting the needs of parents while following our state mandates. We are required to follow the CDC and Minnesota Department of Health guidance regarding COVID policies in order to be eligible for the funding that we receive. Our classrooms have to close or partially close when we have a positive COVID case. This leaves families with no care while they are still trying to work because although their child is not positive, they are considered a close contact, so they've had to stay home with them in quarantine. What increases this challenge is that many of our classrooms are in school buildings and schools don't have the same requirements that we have. You heard from Pat, they have more local control. And although they follow MDH guidance, it's not the same as being mandated to follow every single policy. That often becomes confusing and oftentimes frustrating for staff. Our second challenge has been the hiring of staff. And I think we've seen this in every industry. Ours is no different. We've had openings in our classrooms since September, and this makes it difficult to have consistent staff with kids when you're always shuffling them to cover this or that classroom. But that shuffling of staff has brought me to the first celebration, and our staff, and that's what it is. Our staff have stepped up over and over to look at the needs of a site by showing grace, flexibility, understanding, and the willingness to help each other. They have provided resources to families that are struggling and covered shifts for each other when someone's been ill. They have shown love, empathy, and shared the joy of learning with hundreds of children. And then lastly, it's kids. Kids are still our celebration. We look at the joy and the aha discovery of a child that a child gets when they have an opportunity to play, explore, feel safe with an adult that cares for them. This has been a challenging time for our communities, but their smiles and joy on their faces keep us inspired. Thank you.
Thanks, Jan. And before we hear from healthcare, we'd like to share a picture of our children from Invest Early.
Yeah.
Very nice. And we will now hear from Jean McDonald, President and CEO, Grand Itasca Clinic and Hospital in Fairview Range.
Thanks, Kelly. Thanks for having me today. The COVID impact to our organizations does feel a little lighter in recent weeks, which is certainly a trend we hope to see continue. We're still seeing several COVID inpatients, and just to give you a quick snapshot in time, we currently have 6 COVID positive patients out of 18 here at Grand Itasca. Over in Hibbing, we have 5 positives out of 13 total acute care patients. These numbers change, of course, by the hour, but just to give you a little bit of a snapshot in time, we are still experiencing pockets of capacity crisis, which means we're struggling at times to transfer patients out of our hospitals to a higher level of care. We currently have 4 boarders here in our emergency room in Grand Rapids, 3 of which are waiting for mental health beds, 1 waiting for an ICU bed. This week, we've seen some beds opening up out there at those next level facilities in Duluth and the Metro, which has allowed us to get some patients out to specialists faster out of our emergency rooms than we have in recent history. I don't think we're out of the woods yet, but I do like to see that current trend and hope it continues. And I do hope we're moving to that recovery phase that Pat mentioned. And, you know, focusing on Itasca County, our Grand Itasca testing numbers have been on the decline from over 100 tests collected per day to an average of around 69 per day this week. So we're testing fewer people. We do know, as Kelly mentioned, that a lot of our patients are testing at home. So these numbers are smaller in that way too. Our positivity rate for Grand Itasca has been decreasing as well, but is still high at 21% this week. We were up as high as 33% about a month ago. So those numbers are dipping as well. And we do want to see that positivity rate under 5%. So we definitely have a way to go. And again, we're just cautiously optimistic that this trend will continue. We are offering vaccines to those that are interested and eligible. We expect to see approval from Pfizer and the FDA for that younger age group in coming weeks, which would be 6 months to 4-year-olds. And of course, our priority after caring for patients, much like Jan said, has been to focus on our employees, who have been working long, hard hours caring for patients during this surge. We too have experienced many staff out sick with COVID or out with a child who's quarantined, and that certainly does impact us. We are short-staffed in many areas, which means our employees are working more to cover open shifts, and these have not been easy shifts to cover. You can hear from the statistics that Kelly talked about at the start. We're caring for patients who are sicker than we're used to. And in some cases who frankly should not be in our facility. We'd like to send them to a higher level of care, and again, haven't been able to do that in past months. So the stress and burnout of our frontline workers is real, and we're hoping to see a prolonged decrease in this surge so we can give staff some relief and time to focus on restoring their energy and frankly their passion for healthcare, which, as you can hear on the news, is dipping for a lot of folks in our industry, because our employees really are our greatest asset, and we need them. Our community needs them. So thank you for doing your part, and thank you for your time.
Thank you, Jean. And we'll move to the question and answer portion of our press briefing. And we ask that our media folks put your questions in the chat with your name and the organization you represent. And we have one from Kathy Lynn at KOZY. How are your organizations dealing with the mask negativity and vaccine refusal? And I do feel like this will be a great question for Pat specifically in the schools, because we've probably heard the most from them. But what I do want to add first from a public health lens, we've had vaccine hesitancy in the past. It probably has never been in our history this controversial for many reasons. We truly try to listen to understand. I think that's important in any controversial issue or any hesitancy. We really need to understand where people are coming from. And if they're looking for education, we'll certainly provide that. If they're just looking to express their opinions and maybe aren't looking for advice, we respect that as well. But maintaining that relationship and building that trust is so important. Our healthcare providers are doing that when they can, and masks too. What we try to do really is try to find some common ground. I remember doing these press briefings in the fall, and the common ground really was we want our kids in school. Masked, unmasked, that's where we can all come together, and really working to find that common ground and seeing if we can come to some agreement while addressing this virus, but also keeping people safe. And I'd love to hear from Pat from a school perspective on how you deal with some of that.
I'm trying to think of the right words to say here. First of all, I would say that I agree with you 100%. Kelly, the first thing I wrote down when I saw that, because I thought I would have to answer that question, was education. The second thing I wrote down was respect and tolerance and being grateful and kind in this whole process as far as our approach. But speaking in general about IASC, you can see just in our region, we've all approached vaccines and masks in a different way. And I go back to the decision-making process of, boards making the decision, community speaking to the boards, superintendents working with people like Kelly to give the best guidance we can. And then again, the goal right now is keeping kids in school. So as an example, if we're talking about masks and the sense in the community is, as soon as you say mask, you can lose 40 kids, let's just say that, or 140 kids or 340 kids, that does drive the decision on the importance of masks or no mask, or whether you require it or you don't require it. On the call I was just on a second ago, there was just a quick raising of hands. That's and this is our group of schools and the Iron Range, and it was like, hey, how many are still requiring masks? And it was like half and half. How many are talking about masks? Well, it's all on it's on our agendas in the next 2 weeks to talk about whether we're going to keep doing it or not. So just talking specifically about masks and vaccines, it's just a constant communication, education, being respectful of people. But ultimately, each district has had to be decisive on how they're going to do it. and then use the criteria and stand by it and just stick to it, because I've said it many times, they're going to write the history of this in a few years, and somebody got it right. But in the meantime, we just have to, again, use the criteria you were talking about, or I was just talking about, to make the best decision we can. So it's a really, I danced around that a little bit, because I'm talking about IASC, and I don't want, and I want to make sure I'm respectful of everybody. But it's, again, I go back to it's been very complicated. But I think all the schools are making the best decisions they are for their communities.
Thanks, Pat, and I would fully agree with that. Kathy Lynn, and this is coming back to Pat from KOZY. What is the approximate number of kids out each day from school?
Well, I'm not going to guess. I would say if that's something that, if some statistic you would like, I could get that to you. But I will say this: we got a lot of kids out, and we got a lot of staff out, but it's not all COVID related. We have a lot of, because here's the deal. We've said for 2 years, stay home if you're sick. People are staying home because they're sick, staff included. So it's a double-edged sword. They're doing what we're asking them to do, but at the same time, then, as Jan just said, it's made it many times it's made it complicated to see if we can put a team on the field every day. And as you know, some schools have, my schools, both schools have had to have a day or two off because we can't put enough adults in front of the kids to operate. And Jan, I won't speak for Jan, but that's what keeps her up at night, because she knows, well, I don't want to speak for her, but I know every time we shut down the school, it impacts a lot of young people that got kids. So we do everything we can. We go from education to daycare to education to daycare every day. So if that's something that you would like, I can work on getting that data, maybe on a typical day, what the schools are. But I would just say it's not just a COVID thing anymore. We just have a lot of people that are sick right now.
Yeah, I would agree with you. Every school is a little bit different, but I think, yeah, people are staying home when they're sick, which is a good thing. But yeah, there's more illnesses, more viruses. We had an influenza peak here in Itasca County. We had RSV. We had some other stomach related type of conditions this fall. So yeah. Any other questions from our media? Okay, seeing none, thank you to our panelists, and thank you to all who are continuing to hang in there and work through this pandemic with us. We appreciate you very much.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.